Definition of public health. So it is nothing but the science of protecting the safety and improve health through education and research. And next one, community health. So what do you mean by community health? So it is nothing but taking care of health in all its aspects of life, including the first one is promotion. You're promoting your health, preserve the health by taking a good measures, and last one, prevention of disease. Definition of community health nursing. So, a field of nursing practice for which their body of knowledge and related skills. So, we are using the knowledge and related skills which are applied in meeting the needs of the first one is community, and second one is the family, and third one is the individual. So all over in the community we are focusing the family and individual in their normal environment such as home. So in the home itself we are giving care, and at school we are going and assessing, and some of the preventive measures we are telling how to take care of the dental hygiene, everything. At place of work, so working place we are going and assessing, so with their participation. Characteristic of community health nursing. The first one, advocating for health equity. So that means you have to identify and remove some of the barriers. So for example, some members they have gender difference, they don't want to tell any problems of their own things, so that we have to identify and we have to give treatment to both of them. And next one, addressing social determinant of health. So for example, so we have to teach some of the nutritious food, for example cooking demonstration, and some of the nutrition classes we can able to take. For example, so you can teach about iron rich diet for anemia patients. Okay, so third one, conducting health assessment. So in this assessment you have two things we already studied in the nursing foundation. Subjective means what the patient is complaining, and objective is what we are doing. So what we will do, we'll check the vital signs like temperature, pulse, respiration, BP, and if there is any wound dressings are there, just we'll be assessing, and edema is there, edema scale we'll use and we'll be assessing. And fourth one, providing direct care. So direct care means, for example in the community, so we will be giving some of the medicines, like if they're having the fever we'll give the paracetamol, so in case of diarrhea, so like that we'll be doing, and giving CPR and giving the emotional support. And next one, educating the public. So what education? So if you take the community, the first most important is prevention and control. So for that we have to educate the public. So in hospital just we will be giving the care. So if you take community, so we have to educate them. So what all the things we will educate? So based on the need we will be educating, like how to maintain the health, and about immunization and eating of balanced diet, and main focus prevention and control of various diseases. So now you can able to see, so more cancer patients are coming, so what all the main things we have to prevent cancer, that everything we can able to educate. And last one, collaborating with other professions. So who are they in the community? For example, urban planning and then rural planning committees will be there. To them you can able to join, and then you'll have emergency response teams will be there. So along with them you can collaborate, and some of the social service team. So overall the character is, first one, advocating, addressing social determinants of health, and third one, conducting health assessment, and fourth one, providing direct care, and fifth one, educating the public, and sixth one, collaborating with other professions. Next topic, scope of community health nursing. So the first one, primary health care. So scope, what do you mean by scope? So after finishing the community specialty or knowing community health, you can work in different community related areas. So the first one is primary health care. So here we are focusing on promotion, prevention, treatment, rehabilitation, and palliative care. For example, you can give health education, immunization, MCH care, clean water supply you can take care, sanitation and essential medicine, and prevention of disease. And next one, maternal and child health. So here you are focusing prenatal, intranatal, postnatal. What mean by prenatal? So during the pregnancy. Intranatal, at the time of delivery. Postnatals, after the delivery with the baby you are taking care. And family planning. So family planning, temporary method and permanent methods are there that we are focusing. And child health services, immunization, and then nutrition programs also we are involving. And next one, school health nurse. So school nursing means what you'll do. So you will be focusing all the children's. The main important is dental care, worm infestations, if any immunizations you want to give. So and then you will be health educating the teachers, parents about the nutrition, safety measures, first aid measures, and what all the emergency things, and you will be identifying chronic health condition. And next one, home care. So home care or otherwise is nursing home care. So here we will be doing the dressing and giving injections and what all the basic needs the person need, so you will be providing. And next one, industry. So in the industry what you will do, so the employees will be coming and joining there. So before joining, so you have to check pre-place exam, so whether they are eligible, whether all medical fitness that you have to check. And then periodic examination, so every month you have to checking the major things like blood pressures or any other important things you will be checking. And next one, you can work in the rehabilitation centers. So mostly we'll help the patient with disabilities. And next one, geriatric care, otherwise old age home. So here we are focusing on the mental acuity of the patient and supporting like bathing and meal preparation and physical activity. And next one, mental health center. So here we are focusing on the psychotherapy and crisis intervention. And next one is International Health Agency. So you can able to work in the WHO, UNICEF, USAID, ILO. On to the principles of community health nursing. The first one is holistic approach. So it is focused on physical, social, and environmental factors. Second one, evidence-based practice. So whatever practice we are doing, it should have some evidence. And third one, collaborative. So you have to work with other health professionals and agencies. And fourth one, health promotion. And fifth one, health education. So already we have to give health education to individual, family, and communities. And sixth one, community focus. So we have to understand community needs and resources, and we have to working with their community members. Seventh one, prevention oriented. So the primary prevention, we have to stop the illness or injury. And eighth one, accessible and equitable. So what all the services are giving, we have to give without any discrimination based on age and sex. And ninth one, respect the values, customs, and beliefs. And 10th one, periodic evaluation. And 11th one, community participation. And 12th one, supervision of services. So the junior members are supervised by the senior members. And 13th one, recording and reporting. So these are all the principles of community health nursing. Qualities of community health nursing. The first one is sympathetic. So what do you mean by sympathetic? Just we'll be having the feeling, concerns about other persons, mostly in the community. And second one, empathetic. Empathetic means sharing and understanding. And third one, understanding and respectful. So we have to give respect to the community person. And next one, tolerant. And next one, observant. So good observing power should be there. And cooperative. And next one, interpersonal relationship. And next one, trustworthy. And next one, punctual. So we should be punctual. Then sincere. And then emotional stability should be there. And strong communication. So both verbal and written communication. And finally, professionalism. Dimension of health. So health is multidimensional and dynamic. So if you see, all the dimensions affects everyday functioning of life, and it will determine an individual or a community health. So it includes, the first one is the physical, and second one is the mental. So the first one, physical, so it is focused on the nutritious food, exercise regularly, avoid harmful behavior and substances, and protect oneself from the accident. And next one, mental health. So here, intellectual health, it refers to your ability to think and learn from your life experience. So being an open to new ideas. And next one, emotional. So it involves awareness and acceptance of wide range of feelings in oneself and others, and also ability to express the emotions. And next one, social. So in the social, so we have to live along with the other human beings and developing a positive independent relationship with others. Next one, spiritual. So in this spiritual, people with good spiritual health, they have to identify their own basic purpose in life and learn how to experience love, joy, peace and fulfillment. Next one, environmental health. It means protecting oneself from dangers in the air, water, soil and other consumable products. And next one, occupational. So this includes daily activities. It can include the employment inside or outside of the home, schools. Other dimensions, philosophical dimension, vocational dimension, cultural dimension, educational dimension, nutritional dimension, socio-economic dimension and curative and preventive dimension. One, determinant of health. So the first one, age. So if you see age, the old age peoples are affected with arthritis. So this example you can write. And second one is gender. So if you see gender, if you take female, so for female, cervical cancer, breast cancer is common. And third one is genetics. So under genetics, metabolic disorders, for example, diabetes mellitus. And fourth one, race and ethnicity. So the white racial persons are affected with the disease more common than the black person. And fifth one, literacy. So good educated persons, they will understand the disease very easily when compared to the poor educated person. And sixth one is nutrition. So excess high fat. So what will happen this leads to coronary heart disease. And seventh one is environment. So if you take environment, you have two types. The one is internal, that is inside our body. So we already studied anatomy and physiology. So physiology means the functions within the body cells. So here inside environment will be disturbed. And next one, external. External means housing condition. If the house is poorly built, no proper ventilation, no proper lighting, so that leads to the disease and it affects the health. And eighth one, socio-economic. So for example, so if you see leprosy, so they will be telling this leprosy will be getting only for the poor people and not for the rich persons. And ninth one, socio-cultural. And 10th one, healthcare system. So in this healthcare system, we are focusing on the IMR, MMR, that is infant mortality rate, maternal mortality rate. So this will be affected by the kind of health services If we are providing a good health services, this infant mortality rate will be reduced, maternal mortality rate will be reduced. And last one is other thing, that is age, gender, genetics, nutrition and environment. Of prevention. So the first one is the primordial prevention. Goal to prevent the emergence of risk factors in the population. So here we are focusing on the risk. And next one, strategies, health education. And next one, promoting healthy lifestyle choice. So we have to eat a healthy foods. And environmental modifications, like when you're constructing the houses, good ventilation should be available, and to prevent some of the risk factors from developing in the first place itself. An example, the first one is promoting healthy eating habits, and next one, physical activity. So it has to be started from a younger age itself, so it helps to prevent the obesity, and also it will prevent the related health issues. Primary prevention. Goal to prevent a disease or injury. And if you see, the main goal is prevention aspect. So previous one is the primordial, that is a risk. So here the primary, we are focusing on the prevention aspect of any disease or injury. Strategies, health promotion, health education, specific protection, some of the measures like immunization, safety precautions, and then regular checkup. And if you move on to the example, so providing childhood immunizations like BCG, DPT and so many things to prevent the infectious disease. To one, secondary prevention. To prevent the complication is the goal. Strategy, yearly detection through the screening and prompt treatment of the disease. For example, mammogram to detect breast cancer early stages, or checking the blood pressure, that is a BP screening to identify the hypertension. Tertiary prevention to limit disability and reduce complication. Next, strategies, rehabilitation, disability limitation and support to help the individual. Example, physical therapy after a stroke to restore the functions, or cardiac rehabilitation after a heart attack in order to improve the strength. Next one, iceberg concept of disease. So this is the public health model. So here we are comparing visible and symptomatic disease of the illness. So if you see the iceberg, then the tip of the iceberg, it is visible, and most of the part, that is a large number of hidden parts are there. So that is the hidden cases that we are calling as a subclinical or undiagnosed infection. So that is the submerged part. So you have two, that is the tip, and another one is the submerged part. So you can see the iceberg concept of COVID-19. So you can see the white color, so that is visible. So with the visible symptoms, the diagnosis is a COVID-19 cases, and some are invisible. So that is the misdiagnosed cases, undiagnosed cases, subclinical cases, and some are asymptomatic, and some are pre-symptomatic cases, and some are susceptible populations. So this is about the visible part and then hidden part. So you can have a doubt, visible portion. So that is the tip of the iceberg. So here the cases that are diagnosed and treated by the clinician, and this or the people who seek medical attention for noticeable symptoms. For example, so only the people who are clearly sick with the disease like a common cold, so this is seen outside, so they will go and take the treatment. So what all the symptoms that is shown outside like fever, common cold, sneezing and other pains, we are going and getting the treatment. But the other things we are not going and getting the treatment. So that we are calling as the visible portion, the tip of the iceberg. The next one is the hidden portion. So this is below the surface. So this includes all the cases that are not clinically apparent. That means not visible. So one type is the subclinical infection. So that means the people who have disease but show no symptoms at all. For example, typhoid fever. So they will have the infections in the urine, and they will go outside and they will pass and they will spread the infection. And another one, undiagnosed cases. People who have symptoms but have not been diagnosed, perhaps because they don't go to the medical care. And next one, mildly symptomatic cases. So the infection that causes only minor short-lived symptoms. So they won't recognize at all. So here we are talking about subclinical, undiagnosed, mildly symptomatic. All three are hidden. So if you see, the proportion of hidden cases varies according to the disease. So highly 90% conditions like hypertension are hidden, and 75 to 80% psychiatric disorders are in the hidden condition. So if you want a good example, so this is the example. Visible, the symptoms like rashes and then hair loss, swollen feet, and insulin resistance, these all are visible. And if you see invisible, so advanced stages of some of the illness, liver diseases, cardiovascular diseases, diabetes mellitus, cancer, depression, obesity, so these are invisible. So we are talking about the iceberg phenomena. So this is visible and invisible part. So this is very important question in the community. The next one, why the model is important. So first one, disease surveillance and control. So it is very important for the public health officials. So we have to understand the full scope of the disease, and according to that we have to plan for effective control and prevention. So this is first one is for control and prevention, and second one is screening and early detection. So this model very useful, and it is the importance of screening programs to find out the cases below the surface, and which allows for the earlier intervention and for the better outcome. So here focusing on intervention and health outcome. And third one, planning health services. So it helps in planning future healthcare needs by providing more realistic estimate of the disease burden in a community. So why this model is important? The first one, disease surveillance and control, and second one, screening and early detection, and third one, planning health services. The next one, health illness continuum. So this is the model that views health and illness as a spectrum, and then you have two arrow pointings is there. It is there in the opposite direction. So first we'll see one arrow. So this shows the progressive from the premature death to the high level wellness. So first one, premature death to high level wellness, while other shows the movement from a neutral point. So here the symptoms are absent to the high level wellness. So you have one arrow and another arrow. An individual position is a dynamic and influenced by some of the factors like lifestyle, education, and perception. And the models highlights that proactive wellness efforts are needed to move beyond the simply treating illness. So this is about the health illness continuum. So we see the example model. So this is an example of illness wellness continuum. So you can able to see the premature death, that is in the red color, high level wellness, that is in the blue color. So in the premature death you have susceptibility, symptoms and signs, and high level wellness you can see the awareness, education, growth. So this is the movement from premature death to the high level well. So in middle you can see the neutral point. So this shows the wellness paradigm. So this is the one we are focusing on, the illness wellness continuum. So this is the developmental stages in community health. The first one is empirical era. So this is symptoms oriented, so 1800 to 1850 years. And next one is the basic science era. So this is bacterial oriented, 1850 to 1900. And next one is the clinical science era. So this is individual oriented, 1900 to 1950. And next one is the public health science. So this is community oriented, 1950 to 1975. And next one is the political health science. So this is people oriented, 1975 to 2000 AD. So overall, empirical era, basic science era, clinical science, public health science, political health science era. So the next one is 3000 BC. So there Arogya or health, the term has been derived. In 2000 BC, Ayurveda. In 1000 BC means before Christ. Curative treatment, hygiene, diabetes, and 800 BC Agnivesa Samhita has been developed, and 600 BC pediatric, and 500 BC Jivika, and 272 to 236 BC medical schools has been developed. 100 BC deals the branches of medicine, anatomy, physiology, etiology, pathology, and 200 to 300 AD Shushruta Samhita, so the focus on the surgery, and 500 to 600 AD Vagbata, so therapeutic surgeries, ENT, mental, superstitious disease, infantile disease treatment, toxicology. 1600 British rule. Next, move on to the public health in British India. 1757 military service established. 1825 Quarantine Act was established. 1859 Commissioner of Public Health. 1864 Sanitary Commissioner appointed. 1869 Statistical Officer appointed. 1873 Birth and Death Registration. 1880 Vaccination Act was passed. 1881 First All India Census taken. 1885 Local bodies came. 1888 Local bodies to take care sanitation. 1896 plague occurred. 1897 Epidemic Disease Act. 1904 established lab facilities for research. 1909 Central Malaria Bureau has been established. 1911 promotion of research, and 1912 sanctioned the appointment of Deputy Sanitary Commissioner. So the main important is the birth death registration 1873, first All India Census taken 1881. 1911 promotion of research, and 1897 Epidemic Disease Act. Next one, 1918 Lady Reading Health School established. 1919 Decentralization of Health Administration. 1930 All India Institute of Hygiene and Public Health established. 1931 MCH Bureau established. 1935 Autonomy. 1937 Central Advisory Board established. 1939 Madras Public Health Act. 1943 Boer Committee has been established. 1946 Boer Committee submitted their reports. Next, move on to the post-independence. 1947 Ministry of Health were established. 1948 ESI Act passed. 1950 Republic. 1951 the first 5-year plan has been established. This is very important. BCG vaccine launched. 1952 Community Development Program launched. 1953 National Malaria Control Program, Family Planning Program has been established. 1954 National Leprosy Control Program, VDRL FAA has been established. 1955 National Filaria Control Program. 1956 the second 5-year plan has been started. So each year plan 5 years will be different. 1957 Influenza pandemic. 1958 National Malaria Control Program changed to National Malaria Eradication Program. 1959 Mudalayar Committee appointed. 1960 School Health Committee started. 1961 third 5-year plan has been started. 1962 Central Family Planning in Delhi has been established. 1963 Applied Nutrition Program has been started. Next one, 1964 National Institute for Health Administration started. 1965 ICMR developed, and Lippy Slope, that is a family planning invented. 1966 minimum additional staff required for PHC has been allotted. 1967 small family norm started. 1968 small family norm report has been submitted. And 1969 fourth 5-year plan has been started. And 1970 family planning program has started. 1971 family pension scheme has been started. 1972 MTP Act has been started, that is a medical termination of pregnancy. 1973 minimum needs, that is Qatar Singh committee has been started. 1974, fifth 5-year plan has been started. 1975, ESI, ICDS, smallpox free has been developed. 1976, National Program for Prevention of Blindness. 1977, Eradication of Smallpox. 1978, Expanded Program on Minimum Needs. 1978, Alma Ata on PHC, that is the primary health care. 1980, Smallpox eradicated. 1980, new 20-point programs has been started. 1983, Guinea worm eradication program started. 1984, Bhopal industrial accident occurred. 1985, 7th 5-year plan has started. 1986, Environmental Protection Act started. 1987, new 20 points programs launched and AIDS control program started. 1989, lead safety program started. 1992, 8th 5-year plan started. CSSM program also started. National Control Program also started. And 1993, RNTCP with the dots. 1994, Returns of Play. And 1995, ICDS, the name has been changed to IMCD, Integrated Mother-Child Development. In 1996, Pulse Polio Immunization. In 1997, RCH, 9th 5-year plans launched, and then Leprosy Control Program has been started. In 1992, 8th 5-year plan CSM and AIDS, that is the National AIDS Control Program. 1998 to 1999, National Malaria Eradication Program. It has been converted to National Anti-Malarial Program. 2000, National Population Policy 2000. 2001, first census is taken. 2002, 10th 5-year plan and emergence of SARS. And 2003, National Vector-Borne Disease Control. And 2004, Vande Mataram scheme has been developed. 2005, RCH2 has been started. 2006, Pediatric Growth Chart. In 2007, 7th 5-year plan has started. 2009, Swine Flu Awareness. In 2010, Ambani Hospital in Mumbai has started. In 2012, Indian Institute of Medical Science expanded. In 2014, 7 vaccine preventable disease and pentavalent vaccine has been introduced. 2017, 12th 5-year plan has been started. So same time, National Health Policy 2017 also started. 2018, Ayushman Bharat program, and 2020, insurance schemes for health workers, and also there is the fighting with the COVID-19. And next one, you have the question, is there any 13th 5-year plan in India? Okay, next move on to the concept. So 13th 5-year plan does not exist in India. So after the conclusions of the 12th plan, that is 2017, the Planning Commission was dismantled, and then NITI Yoga took over as a primary body for strategic planning and then policy formation. So there is no 13th 5-year plan. So the name has been changed, NITI Yoga. So this is a primary body for planning the commissions. Okay. So this is about the 13th 5-year plan. So next one, NITI. What do you mean by NITI? National Institute for Transforming India. And then you have some of the chairpersons' names, vice chairman and ex-office members, CEO and full-time members and special invitees, and governing council and regional council. So here you have the 7 pillars. So the first one is the pro people, pro activity, participation, inclusions of all, empowering, equality, transparency, and you have some of the objectives out there. And so in this faster cooperative federations. Okay, next one, key initiatives. You have a lifestyle for environment, national data and analytics, and then so you have so many women's empowerments. So this 8 we are considering as the key initiatives of NITI. So what is NITI? National Institute for Transforming India. So this is about 13th 5-year plan. Next, move on to the natural history of disease. So here you have two stages, that is the period of pre-pathogens and period of pathogens. So period of pre-pathogens, you have the process of agent, host, environment. So first we'll see the disease process. So in the disease process, next we'll move on to, so before the man has involved, so it is contact with the agent, host, environment. So already you know what do you mean by agent. So the causes of disease, example virus, and host organism where it is getting, so for example human. And environment, so external factors like climate, sanitation, and social condition. So bring this agent, host, and provide the appropriate. Suppose if you get the stimulus, what will happen? So it is enter into the human host, and then interactions of host and stimulus, then host reaction occurs, then yearly pathogenesis, and then dissembles yearly lesions, advanced disease, and convalescent stages are coming. So next one is the thing is before that stimulus become established. Now what happened? Tissue and physiological changes are occurring. And then you have the clinical horizon, signs and symptoms, illness. If the illness, if you have immunity resistance, you will have the recovery. And then you have, if your illness are not recovered, what will happen? Disability, defect, and then clinical, you have the chronic state, and final you have the death. So this is about the pathogenesis. The next move on to the levels of prevention. So you have the primordial prevention, primary prevention. So in the mode of intervention, primordial prevention is the health promotion, and primary you have the specific protection, and secondary if you see early diagnosis and treatment. And if you move on to the tertiary, you have disability, limitation, and rehabilitation. So you have pre-pathogens and pathogens. So in the pre-pathogens, the main thing is agent, host, environment. And pathogens, if you have immunity and resistance, so you will have the recovery. Suppose if you not have immunity and resistance, what will happen? Disability, defect, chronic state, death. So to prevent this one, the disease process, you have so many preventions are there. So first one is the primordial. So in the early stage itself we are preventing, then primary, and then one secondary, and then tertiary. So the mode of intervention for the primordial and primary, health promotion, and then you have giving the specific protections like immunizations and all. So already this topic have been discussed the previous one, so you can have it. And secondary, yearly diagnosis and treatment. So in the tertiary, so we can't able to do. So here if it is having any disability, so we are giving some of the rehabilitation. So this is very important, natural history of disease. The next one, major health problem in India. So if you focus this one, so the first one is the communicable disease problem, non-communicable disease problem, and then nutritional problem, and then environmental sanitation problem, medical care problem, and population problem. So each one will discuss in detail. So you have communicable, non-communicable, nutrition, environment, medical care, and population. First one, communicable disease problem. So this is continue to be the major problem in India. So the first one is the malaria, and then tuberculosis, diarrheal disease, and then acute respiratory diseases, and then leprosy, filaria, and then AIDS, and then other diseases. So when they're asking in 15 mark questions, so each one you have to explain in detail. If it is 5 mark, just you can mention malaria, tuberculosis, diarrheal, acute respiratory, leprosy, filaria, AIDS, and others. Suppose if it is in 15 marks, so you have to explain about the malaria in very detail, and tuberculosis, what are all the drugs or NTCP, what all the programs are available, and diarrheal disease, how you will manage everything, like that you have to explain in detail. Next one, non-communicable disease. So that means it won't spread. So it will affect the inner organs and it won't be spread. Okay, so for example, cardiovascular disease, chronic respiratory disease, diabetes, and cancer. So this 4 are major things which is non-communicable disease. That means it won't spread from one person to another person. So if the person is affected with cardiovascular disease, it will affect the inner organs only itself. The next one, environmental health problem. So the major one is open defecation, malnutrition, and contaminated water. Some of the other things are climate change, and then will the environment, agricultural practices affected, occupational risk, community noise, radiations will increase, chemicals, and inadequate water and sanitations. So because of the diarrheal diseases, everything will come, and then air pollution. So this is a major thing because we are using so many plastic items and we are burning, so everything will be affecting. So air pollution, and then inadequate water sanitation, chemical exposure, radiation, community noise, occupational. Next one, medical care problem. The first one, inadequate financial sources, and second one, health benefits to the urban population. So there is migration from rural to urban, uneven distributions, and migration to the urban. So you have a health problems because of the congested areas, and aggravated like overcrowding in hospital, inadequate staffing will be there, and scarcity of some of the certain drugs and medicines. So this are all the major medical care problem. So inadequate financial, then health benefits, then uneven distribution, then migration means moving from one place to another. So because of lack of job facilities from the rural, they are migrating to the urban area. And then so because of overpopulations, overcrowding in the hospital. So when they're overcrowding, the staffs are very inadequate to care, and certain drugs and medicines are scarcities are available. And next one, the nutritional problem. So protein energy malnutrition, nutritional anemia, iodine deficiency disorder, vitamin A deficiency, low birth weight, and then endemic fluorosis, laterism, and then market distortion, cardiovascular disease, and cancer. So these are all the nutritional problem. And other thing, if you want to write, you can write about vitamin D deficiency, calcium, vitamin B, zinc, and then xerophthalmia, nutritional anemia, and then fluorosis. So regarding the nutrition deficiencies or all the problems, everything you can write in major nutritional problems in India. And the next one, population problem. So under this, unemployment and inadequate infrastructure. So if you see, so many populations problems are around there. Thank you everyone. Like, share and subscribe. So in this video we are covering the full first unit of community health nursing 1 5th semester. Thank you.